So after these 14 days, what are some of the first symptoms I can expect to see or feel within my body?
Okay, so by far the majority of people, they are actually asymptomatic. In other words, they do not exhibit any symptoms during the early days of exposure, or the period that we call seroconversion. Right, and a significant number of people, they have got very non-specific symptoms, things that you can't actually point to anything, and which can easily be mistaken for a flu-like illness, for example. So some of the common symptoms include fevers, headaches, you can get diarrhea, you can get a rash that comes and goes quickly. As subtly as the symptoms come, they can also disappear. Some people may present with what we call lymph nodes, shona darobe mtochera or mambavu. For educational purposes, I think it's important to highlight that the early days of infection can easily be missed, or they can be mistaken for just a common or seasonal viral infection.
When we talk about viral loads and CD4 counts, how does that relate to treatment?
Viral load, essentially, in terms of following up people, what we want to know is that the person is not manufacturing new viral copies, right? So that's why the viral load is important. So we monitor the viral load as a sign that we have managed to bring down viral replication. So we talk about viral load every 3 to 6 months. Practically speaking, usually every 6 to 12 months, especially because of resource limitation. So it's just a marker of virus activity, and also an indicator of how well our anti-HIV drugs are performing. The idea is we want to keep the viral load undetectable. The viral load, we also use it sometimes in the early stages of treatment selection. So sometimes when the viral load is so high, you would want to bring in your big guns so that you bring the viral load down as fast as possible. The CD4 count, on the other hand, is how well your body's own immune system has managed to recover from the infection. Right, so we normally take viral load at the beginning of treatment. We want to establish the degree of immune suppression, or how compromised your immune system is. And so that viral load, it also helps us to screen for certain infections. The lower your viral load is, the more we would want to screen for a lot of HIV-related infections. Somebody with a CD4 count of less than 50 versus somebody with a CD4 count of 400 and above, the amount of tests that you need to exclude things like TB, meningitis, toxoplasmosis, and many other infections. So that is actually absolutely important, and it also helps us to track your recovery. So if you started off at this CD4 count, after some time you want to see your CD4 count recovering. So generally, the lower the CD4 count, the higher the chances of certain infections. Although there are certain caveats that may not be necessary for this discussion, there are certain people who can maintain relatively low CD4 counts but never suffer from any serious infections. There are people who have got relatively high viral load, but they can still come down with TB. But in general, the higher your CD4 count, the better you are protected at opportunistic infections.
How do we reduce the stigma around HIV and AIDS, especially for children who have been born with the virus?
I'm happy that we are already doing it. So talking about it is part of the process of reducing stigma. This is a conversation that every family needs to be able to have. This is a conversation that we should be able to have at church, pabira, wherever people gather. We should be able to talk about it, and we also hope that we will have more and more champions speaking up about their experiences with the virus, because people are motivated by a success story. So the more we see people talking about their journey with the virus, we have got people we know who have been HIV positive for 20, 30 plus years, you know. So their stories, they help remove the idea that the virus is a death sentence. And also, I guess the more and more people are free to talk about their sexuality, the more we remove the stigma around the idea that you got this virus because you're a bad, terrible person, you're a bad mother, bad business person, So talking about it is the way to go. And also just encouraging mass testing for HIV. I think if everyone and their drinking buddies can just go to the nearest place and get tested as a group, that can also help just to remove the aura of mystery around the virus.
Where does research currently stand when it comes to the HIV vaccination?
Right, that has been quite a long and bumpy road. But at the present moment, Zimbabwe is one of the beneficiaries of certain grants where we are conducting what we call phase 1 clinical trials for HIV vaccine. Essentially, we're just looking for a small group of people to test if these drugs are safe. So phase 1 means we are not talking about how effective the drug is. We just want to know that if we give you this substance, you are not going to suffer any serious side effects. The fact that we're at phase 1 trials means we are closer to the phase 2, 3, and 4 phases of drug development. It's still pretty much a couple of years to go before we actually have a drug that is known to be safe, effective, and that can actually be rolled out at a mass level. But some things are actually happening. A couple of different types of vaccines are actually in development. COVID kind of helped because it was one of the first viruses to test what is called an RNA virus, which helps speed up the development of HIV vaccines. So we are hoping that sooner rather than later, we in Africa will also be participating in some of these RNA vaccines for HIV. So it's on the horizon, but in the meantime, we are left with what we already know, the preventive measures.
Do you get a lot of volunteers to try out these potential HIV vaccinations?
I think I will need to actually refer to some of my colleagues who are actually involved in the HIV vaccine studies. But generally, they only need, I think, about 120 to 150 participants. I'm not sure where they stand in as far as that is concerned, but it's an achievable target.
And as part of my Pokello HIV testing campaign, I always encourage the youth to know their status, to get tested. How does the ELISA test compare to the over-the-counter test kits?
The rapid diagnostic, or the RDT tests, most of them, they pick the HIV antigen or the viral particles themselves, which means they can now detect the virus quite early as well, almost comparable to the ELISA. In some tests, they can actually pick both the antigen and the antibodies. But as of now, we consider the ELISA the gold standard for the diagnosis of HIV. So every sample that is submitted to the lab, for example, it undergoes the rapid diagnostic test first. If it comes out as positive or negative, then you run the ELISA test. So to confirm whatever result you got from the rapid diagnostic test. So in terms of differences, it's convenience really. The rapid diagnostic test is quick, it's cheap, and you can run them every day if you want, in the comfort of your home. No need for a needle stick and submitting the sample to a lab, which can actually require sometimes the whole day to run for you to get a result.
Yes.
Right. So in terms of difference, the ELISA is more sensitive, it's more specific, right, and it's the absolute. It is the final say after you have taken your rapid diagnostic test.
What are the effects of HIV and AIDS, and what can we expect to see, for instance, for people who have had it for a long time or in the elderly people?
One of the areas that has been taking center stage in terms of HIV treatment, follow-up and research has got to do with issues of HIV virus infectivity and positivity rather, and premature aging. We have noticed that people who are HIV positive, they tend to get certain age-related conditions at a relatively younger age than their HIV negative counterparts. For example, things like stroke or heart diseases, including heart attacks, they tend to happen at a younger age in people who are HIV positive than in their negative counterparts. So it's an area of ongoing research to do with HIV and non-communicable disease. So it raises a couple of important issues for people. Number one, we know that if people take too long before they test for HIV, even if they achieve an undetectable viral load, they tend to have pockets of virus in their body, places where the virus can hide, continues to multiply, and leaves the body in a state of continuous immune activation. In other words, the body is always trying to fight these virus that are continuously being shed off. So whenever the immune system is activated, it deals with the virus, but it also causes damage to different parts of the body. So issues to do with arthritis, your bones and everything like that, your blood vessels, even your brain or your nervous tissue, where you end up things like HIV-associated neurocognitive decline. So the message is people should be tested early and start treatment very early so that we prevent the creation of pools of virus. Some can hide actually in your nervous system. Some can hide inside your intestines, what we call mouth-associated lymphoid tissues. So we want to make sure that we deal with those camps or pockets of virus collection. And if we start treatment early, we also hope to reduce the rate at which people age. So in other words, we are telling HIV positive people that we want to delay the onset of arthritis. We want to delay the onset of heart diseases. We want to delay the onset of strokes and even dementia by making sure that we identify HIV early and we've treated it on time.
Like with my HIV testing campaign, we focus so much on testing the youth, but not testing the elderly people. Why is that?
Yeah, so that's also an important observation that we have noticed. Even us as clinicians, sometimes we are guilty of ageism, where if an elderly patient comes, we are more concerned about things that are age-related, and we forget that at some point these elderly people, they had risk factors for acquiring HIV. So people just try to sometimes just for no reason, or just out of fear of the unknown, we don't test the elderly people for HIV, and we have seen very late presentation among elderly people. So the message is our elderly gogos and our elderly mothers, they will still need to be treated for HIV.
And tested for HIV.
And they need to be tested for HIV, because sometimes it feels disrespectful to suggest to your mother or your grandmother that you need HIV testing. It comes back to the issue of stigma again. It almost appears like you're accusing them of something. But it's very important, because HIV messes up the treatment of all the other things that are already present in that age group. They are already suffering from a lot of things, and
high blood pressure
and all of that. So comprehensive care means we are taking care not just of those things, but also of HIV if it's there.
Thank you everyone for tuning in. I hope we've answered all your questions that you have regarding HIV and AIDS. And as we say with our Pokello HIV testing campaign, know your status. Thank you.